Have you ever wondered if cancer might be lurking without your knowledge? It's a frightening thought, but many people overlook early warning signs, delaying seeking medical help. Cancer is relentless, and it can strike unexpectedly. Whether it's for yourself, a family member, or a friend, recognizing warning signs is crucial. Cancer doesn't discriminate, and early detection can save lives. Often, these symptoms are mistaken for something less serious. Understanding and spotting these signs could make a life saving difference, maybe even your own. So, what are these signs, and how can you differentiate them from common ailments? In this video, we'll explain 7 early signs of cancer. By the end, you'll be equipped with the knowledge to take charge of your health and potentially catch cancer early when treatment is most effective. Let's dive in. 7. Unexplainable weight loss. Sudden and inexplicable weight loss, particularly a significant drop of 10 pounds or more, or an unexpected loss of appetite, might set off alarms indicating the possible presence of certain cancers, specifically esophageal, lung, or stomach cancers. When cancer establishes itself, it can stealthily trigger weight loss, even if you're sticking to your usual eating habits. This weight reduction phenomenon occurs because some cancers, through various mechanisms, can interfere with your body's ability to absorb and use necessary nutrients, leading to a gradual decline on the scale. The mysterious weight loss unfolds due to the insatiable appetite of cancer cells. They have a knack for rapid growth and division, consuming a considerable amount of your body's energy resources. This heightened metabolic frenzy can cause you to shed weight as your body struggles to cope with the increased energy demands, often preceding the onset of other noticeable cancer symptoms. It's essential to remember that while unexplained weight loss can be a potential marker for cancer, several non-cancerous conditions share this trait. Medical conditions such as thyroid disorders, diabetes, gastrointestinal issues, or chronic infections can also lead to a drop in weight. If you find yourself shedding pounds unintentionally and rapid, it's wise to consult your doctor for a thorough evaluation to pinpoint the cause and ensure appropriate care. 6. Change in bowel movement. When it comes to persistent constipation, enduring diarrhea for several weeks, or experiencing frequent or painful urination or bowel movements, it's a cue to book an appointment with your doctor. While changes in bowel habits could signify inflammatory bowel disease, like Crohn's disease, they might also raise the possibility of colon or stomach cancer. Similarly, shifts in urination patterns, such as pain during urination, increased frequency, or a weaker stream, could indicate various issues, ranging from a urinary tract infection to an enlarged prostate or potential prostate or bladder cancers. Moreover, pay attention to the color. If your stool appears bright red or maroon due to fresh blood, or if you spot streaks of blood on your stool, this might indicate a concern, especially if the cancerous growth is located toward the end of the bowels, like the descending colon or rectum. Reflect on your bowel movements and consider any other accompanying symptoms of cancer. If you notice these changes and also exhibit some of the risk factors associated with cancer, it's crucial to speak with your physician promptly for further evaluation. While changes in bowel habits can be attributed to aging and might not always raise immediate concern, coupling these changes with additional cancer-related symptoms or risk factors warrants medical attention to rule out any underlying issues. 5. Changes to skin. When recovering from an infection, like a cold, if you observe lumps in your neck or throat due to swollen lymph nodes, it's generally a familiar response. However, it's crucial to have these symptoms assessed by a doctor if they persist after your recovery, or if you notice unusual lumps or swelling in other areas of your body, such as the armpit or testes, without a clear cause like an infection. Swelling or lumps in these areas might indicate genitourinary cancers, such as prostate or testicular cancer in men, or breast cancer in women or men. Keep an eye on the changes to the color, size, shape, or new developments like freckles, moles, or warts. These changes should be promptly evaluated, as they could be indicative of skin cancer. The color and shape of a lump play a crucial role in diagnosis. For instance, a mole that changes color, exceeds the size of a pencil eraser, or has an irregular border raises concern for possible skin cancer. If a mole is asymmetrical, has jagged edges, and irregular borders, changes colors, gets darker, or is large or growing, it should be promptly examined by a doctor. Moreover, alterations in skin color, such as jaundice or yellow cast, may be attributed to infections, liver disease, or potentially signal pancreatic cancer or metastasis to the liver. These signs are not exhaustive, and any noticeable change in skin coloration should be reported to your doctor for a thorough evaluation. 4. Fatigue. While talking about fatigue linked to cancer, it's not the usual tiredness you experience after a long day's work or play. Instead, it's an extreme fatigue that persists despite rest and doesn't improve. Cancer, as it grows and progresses, utilizes the body's nutrients, diverting them away from nourishing the body. This nutrient theft can lead to pervasive feelings of extreme tiredness. However, it's essential to note that fatigue can stem from various underlying causes, not all cancer related. If the symptoms significantly impact your daily life or are severe, consulting your doctor is advisable. If you're experiencing a drastic decrease in energy levels that doesn't recover with adequate sleep or relaxation, seeking medical advice can help rule out potential causes like leukemia or lymphoma. Keep an eye on associated symptoms like muscle weakness or confusion, as they could point to other types of cancers affecting hormone levels or causing internal bleeding, such as colon or stomach cancer, which might contribute to ongoing fatigue. If you observe these signs, discussing them with your doctor for a comprehensive evaluation is crucial. 3. Difficulty in swallowing. When you face difficulty swallowing, also called dysphagia, it could signal cancers impacting areas like your head, neck, mouth, or jaw. Tumor growth in these regions might lead to blockages or changes in the normal functioning of your mouth or throat muscles. In specific head and neck cancers, such difficulty arises when tumors create obstructions in your throat or impair the regular movement of your lips, tongue, or throat muscles. Apart from cancers, health conditions affecting your nervous system or digestive tract, as well as certain cancer treatments like radiation therapy or surgery, can also contribute to swallowing difficulties. If you experience a sensation of food getting stuck in your throat while eating, or persistent trouble swallowing for more than 2 weeks, it's crucial to consult your doctor promptly. These symptoms could indicate underlying issues related to throat, lung, or stomach cancers that need professional evaluation and diagnosis. 2. Cough or hoarseness. A persistent dry, hacking cough that lingers for more than 2 weeks, especially if you notice blood in your cough or a bloody discharge, might be a sign of lung cancer. Hoarseness, which refers to changes or weakening in your voice, can be caused by inflammation of the voice box or larynx due to infections or overuse of the voice. In lung cancer cases, hoarseness often results from recurrent laryngeal nerve palsy. This condition often involves paralysis or weakness in the recurrent laryngeal nerve, which is responsible for controlling the larynx. Tumors in the left lung are more likely to press on this nerve, leading to hoarseness. It is worth noting that although less common, tumors in the right lung can also cause recurrent laryngeal nerve palsy. While a cough alone doesn't necessarily mean you have lung cancer, it's a prevalent symptom at the time of diagnosis. According to a study, 54% of people with lung cancer who are not undergoing treatment had a cough. This underscores the importance of paying attention to persistent coughs, especially if they don't seem to have an apparent cause or if you have an unresolved illness. If you're dealing with a cough that won't go away or an illness that just won't resolve, seeking medical attention is crucial, as it could be a warning sign of lung cancer. 1. Persistent pain. Pain can happen for many reasons, and most of the time it's not because of cancer. But if you have pain that doesn't go away and you're not sure why, it's important to pay attention. Our bodies use pain to tell us when something might be wrong. As we get older, we might feel aches and pains, and that's normal. However, if you have ongoing or unexplained pain anywhere in your body, it could be a sign of something more serious. Cancer can sometimes cause pain by pressing on other parts of the body. The release of certain chemicals by cancer cells, or metastasis, which is the spread of cancer from its original site. If you're dealing with pain that sticks around and you're not sure where it's coming from, talk to your doctor. They can help figure out what's going on, run tests if needed, and guide you on the best steps to take based on your health. It's important to catch and address any health issue early. Recognizing these 7 signs of cancer is crucial. If you notice any of these symptoms, it's important to seek medical help right away. Early detection is key for successful cancer treatment. Being aware of these signs increases your chance of catching it early, improving your chances of getting better. Don't wait for symptoms to get worse. If you're worried or notice anything unusual, it's best to talk to a doctor without delay. If these insights sparked your curiosity, dive deeper into wellness with us. Hit that like button, subscribe, and tap on notifications for your daily dose of health wisdom and nutritional secrets.